Hello class, my name is Katie and we will be talking about the growing provider shortage in healthcare. Healthcare providers obviously play a crucial role in the delivery of healthcare. A shortage of providers can lead to a lack of adequate care for the community, especially those smaller rural areas. Physician shortages ultimately influence how care is being rendered, and this can contribute to poor healthcare outcomes. According to the Association of American Medical Colleges, or the AAMC, the United States could face a shortage of up to 139,000 physicians by 2033. The Health Resource and Services Administration, or the HRSA, has estimated that there will be a shortage of between 21 and up to 55,000 primary care physicians by 2033. Some contributions to the shortage could be geographical restrictions. Healthcare providers tend to concentrate in urban areas where there is a higher density of population, like big cities, and this leaves sparsely populated rural and underserved regions with limited access to care. The uneven distribution of providers exacerbates healthcare disparities. It also widens the gap in access to quality healthcare services. Another issue could be the Affordable Care Act. While this act increased healthcare access throughout health insurance coverage, the act also made it harder for clinicians to be reimbursed, especially those that served an aging population. The Affordable Care Act also mandated the adoption of electronic health records, or an EMR, and many healthcare professionals who had smaller practices, the expense of deploying an entirely new EMR system was simply unaffordable, and this led to closures of certain clinics. And then 10 years later, in 2020, we had COVID-19. COVID became a global pandemic, and providers experienced burnout as a result. And this was from imbalanced staffing ratios, heavy workloads, long work hours, separation from their family for days upon days, sometimes even longer. All of this added to the problem of the provider shortage. The healthcare system that we have today was created by choices made by our forebears. The future of healthcare depends on our ability to understand how our healthcare system has evolved. For better or for worse, we also have to evolve. And to do this, we need to make changes, and we also need to provide incentives to fill our provider roles. Quality of care and maintaining out-of-pocket costs, all of that with increased access to care, it's all dependent on the accessibility of physicians. Having a shortage of physicians not only impacts the level of care that is delivered, but it also drives up the cost for the services that can be rendered. Increased funding for healthcare education is crucial to ensure the availability of the skilled and competent in the healthcare service workforce. Several strategies can help increase funding for healthcare education. Providing tuition reimbursement, implementing loan forgiveness programs to healthcare providers can be effective incentives. This would reimburse a portion or all of their education expenses, as that can help offset the financial burden of the education. Providing opportunities for professional growth and advancements can incentivize healthcare providers. This offers mentorship programs, leadership development, continuing education opportunities, etc. Support for research and specialization can help providers feel valued and supported in their professional development. This can also foster a supportive environment that can be hard to come by in today's business. Promoting work-life balance and addressing the causes of provider burnout is also essential in ensuring the well-being and retention of healthcare providers. Implementing policies that address these issues, including allocating sufficient healthcare personnel and infrastructure to meet the demand and distribute the workload more evenly, reducing the burden on individual providers, and providing a more healthy work-life balance. In addition, we could look at flexible work arrangements, flexible schedules, possible job sharing. With today's technology, there are also telehealth, telecommuting options. This flexibility would further help a lending hand in the struggle for work-life balance. This can also be particularly beneficial for those with caregiving responsibilities or other commitments. In a study conducted by the Centers of Disease Control and Prevention, or the CDC, in March of 2022 by Tapas K. Ray and Regina Panna, the effects of work flexibility and workers' well-being, they found taking time off decreased the likelihood of job stress by 59%, decreased the days with activity limitations by 22%, and more than doubled the likelihood of job satisfaction. Changing one's schedule decreased the likelihood of job stress by 20% and increased the likelihood of job satisfaction by 60%. Healthcare at its core is a people-centered profession that focuses on the well-being and care of individuals and also large communities or small communities. While statistics and productivities have their place in healthcare management and planning, it's also essential to prioritize the human aspect of healthcare delivery. There's more on the line here than a loss of profit. Mistakes in healthcare can cause loss of life. Provider shortages can ensure that we don't have the resources needed to maintain quality of life when it comes to medical issues. We can achieve patient-centered, compassionate, and effective healthcare services by working cohesively as a team. We need to prioritize the people receiving and providing care and integrate their perspectives, values, and preferences into healthcare decision-making. As the healthcare landscape evolves, healthcare management education must adapt to meet the changing needs and demands of the industry. As the healthcare landscape evolves, healthcare itself must adapt to meet the changing needs and demands of the industry. Thank you for listening, and I hope you all have a great week.